Telehealth's a rapidly growing new way of delivering care. It's an innovation enabled by technology, but most importantly, it accomplishes a number of objectives we aim for in improving the U.S. healthcare system. 1, provide quality care. 2, it encounters that are more convenient for patients. So think about having those visits at home or on your smartphone. And 3, reducing cost. Telehealth encounters cost significantly less than a typical PCP encounter and a fraction of an urgent care visit, not to mention an ER visit. There are a number of companies providing these services now, many of those offering PCP-like consults, whereas others specialize. For example, there's a company that specializes on concussion assessments that combines the cognitive test as well as the video consults. So, Michael, while telehealth companies have state-of-the-art technology and their own limited versions of EMRs, they typically are not integrated into the mainstream care workflows. That is, they're not leveraging clinical data to the extent possible. So what are some of the telehealth use cases that will benefit from leveraging interoperability?
Well, in many ways, the use cases are similar to the ones we've already seen with other provider types, at least in the past. So while eligibility is obviously a core baseline necessity to perform any encounter, it's already part of the telehealth technology platform. But many others are rarely or not yet implemented. Here are a couple examples. Patient history. Before a virtual encounter can proceed, a patient needs to fill out a patient history or patient assessment form for the physician to basically move forward from there. And to be fair, that is better than filling out a paper form, which we still have to do in some cases. But at the same time, there's better ways to pull that information via interoperability, for example, from the patient's primary care delivery system and their EMR system. So not only would that obviously save the patient a lot of hassle, but it also is much more complete and accurate information for the telehealth provider, for example, on labs, on prescriptions, and on past encounters. A second example is post-encounter reporting. In this use case, any records from the telehealth encounter will go back to the PCP or the primary care system, and then also become available for the patient and the health plan for a number of use cases, including quality reporting, gap closure. In other words, and we already see this with other provider types like specialists and hospitals, closing the loop with the PCP is common practice. So of course, these records will also need to be accessible for the patient down the road, and like we said, for health plans. So enabling interoperability in this case will not only make it much more efficient, but also make it much more timely, i.e. real time.
Yeah, so these are some of the basic use cases, and I think we'll see these become interoperable enabled soon. What other telehealth enabled use cases should we expect to see in the future?
It's pretty exciting to consider the use cases I think we'll see on the telehealth platform. We will see services currently delivered by other provider types, such as well visits, counseling, and gap closure type activities, but at a lower cost on the telehealth platform, which will really be aided by adding capabilities around ordering services and tests. Actually writing scripts and ordering scripts is pretty well integrated into most leading platforms already. And that will make a huge difference, again, because it drives costs down while convenience goes way up. In addition to that, there seems to be mounting evidence that telehealth reaches segments of populations that are not easily reachable in other ways. So that will also help, obviously, get assessments on a broader set of members in certain populations and deliver effective care, including preventive services to those populations. So very exciting, I think.
Yeah, and I agree. It is exciting to see what the real impact we can have in healthcare when combining these two powerful innovations like telehealth and interoperability. So that's it for today, and we will see you next time.